on and how dealing that with that. And if you notice on the bottom right there underneath the graphic, you can see the website for our report, and you'll also see at the end, so you can download and read all about this for yourself, more into the dimensions. And Jay, if you could switch over to the next slide for me, please. Thank you so much. And as Guillaume said, as we were going through the information that everybody from across the country was telling us, we started noticing themes. And these are what we decided to call the constants and the aggravators, because of constants, always something that is there, and aggravators, something that makes poverty worse, or your experience of poverty worse, it can deepen it. The one thing that came up was in time. And then when we talked about, as I just mentioned, in poverty, the health conditions that start in childhood can carry over to adulthood, regardless of whether your economic status changes. One thing that we heard was that in poverty, you die sooner because you may not have access to doctors because of those health conditions. We also talked about the fact that people in poverty's time is not viewed as valuable as their middle income or upper income peers, with the idea that, well, you're in poverty, you must not be working, so you can keep coming back and back and back if you need to provide paperwork for a much needed subsidy. Or the idea that I only have a little bit of money, I need to go from store to store to store to try to feed my family Also, the idea of how all of these things are accumulated to you, the accumulation of dimensions. And what was really interesting, someone said, like, some problems that you have, maybe you can deal with one. Maybe I can deal with the fact that I live in a disadvantaged area, but I have a good job and my kids are going to a good school and I can take care of my family. But if you live in a disadvantaged area, you don't have healthcare, you are underemployed, you don't have transportation back and forth for work, all of these things that build up on you, it's hard to use your problem-solving skills or get that weight lifted off of you, because we know cognitive ability is finite and it's just one thing after another. Racism was huge when we talked about how the idea of how society, and everyone does this, whether it's blatantly or subconsciously, affects people. The racism can affect people and their experiences in day life, whether it's outright blatant or microaggressions. And I love this quote that was from one of our activists in the research, said, "I'm treated like a third-class citizen in a country that my family has been in since before there was a country." And the way I described it is that if you have a African-American gay woman with a disability and you have a straight white male, they both have the same amount of money in their pocket, they both have the same amount of money in their bank account. The woman's experience will be completely different of the straight white male because of racism. And this because she is pushed further and further away from her power. All this, and because of social identity, how we view people, which is actually like how I view me versus how you see me, and how you use that society can use and institutions can use everything that people take pride in about themselves and turn it against them. And like, as we said, being a white female and from a rural area, we're usually viewed as uneducated, and our accent is an embarrassment for many, but I'm proud of it. Like she said, she took pride in her accent where other people would turn it against them. The other biggest thing that has an effect on poverty is the constants. And we talked about uncertainty. We know that, like, regardless of who you are, when you wake up in the morning, you don't know how your day is going to be. But when you live in poverty, it's that much harder, because are you going to face a 0-hour work week where you may be on this, you may be still employed, but you're not on the schedule. And 2 weeks from now, you're not going to get a paycheck. And we talked about no-fault evictions, or just not knowing what's going to happen in life. Maybe there's a medical expense that pops up and you don't have the insurance, and how all those uncertainties lead to hard choices. One of the activists said, our choices are only ever dire because the perception of people in poverty is that they make bad choices, not that the only choices in front of them, regardless of which one they pick, will have a dire consequence. And as I just said, so if you have a 0-hour work week in Boston sometime where I live, it can be 4 degrees in the winter. So next week, you're going to have, do you put food in the refrigerator? It's cold. Do you pay for the heat? Do you buy your kid new boots or a winter coat? And with poverty, every one of those things that you give up to go for something else is viewed as neglect, opposed to a consequence of poverty. So if we can move on to the next slide, please. So now that we told you a little bit about the dimensions, I'd like to talk to you about how you can use them in your work and for real world applications. So as we've been like a year into COVID right now, we know that the impact on populations with the lowest income and people of color had the greatest effect on them. But as we were talking about this at the very beginning amongst ourselves, MAP researchers and Guillaume and myself, we kind of already had an idea of who might be greatest affected because of what everybody told us what they were going through to begin with. The idea that, you know, I live in this area, I'm having trouble paying rent. And we see that now with the massive evictions. I can't buy food, I'm having struggle paying food. And we see that now with massive lines at food banks. Healthcare, you know, people that were before struggling and surviving on home remedies are now having problems to access healthcare during this crisis. We also talked about the idea of that how you will be affected most lives on based on where you live, who you are seen as a person, the idea of isolation now. You know, everybody's at home working. The people that were isolated beforehand and need the community most to rely on to help them with healthcare and with food are still even worse off. And when we look at the dimensions to look at, see who may be most affected and what we can do to remedy this, I like to think about, so you may remember a few weeks ago hearing about a manager at a Tyson food plant where they were taking bets amongst themselves which employees would catch COVID. People were shocked when they heard it, and that's rightfully so. But I think that personally that like we talk about work and employment hardships. The one thing that came up over and over again in that dimension is that people were saying that we feel like we're disposable. You know, it doesn't matter if we don't show up, we can be fired, we can be treated as like, it doesn't matter. Our safety concerns, it doesn't matter. And I think that's a perfect example of things that were there beforehand, but we're now seeing as light. Think about now is like, we look at grocery clerks as essential workers, but pre-COVID, they were considered unskilled or menial labor, unworthy of a living wage, you know? We can also talk about racism and how that's popping up. And we're seeing this huge in COVID. You know, when BIPOC people were disproportionately affected by COVID, the reasoning became behavioralized, not systemic. And I also remember like one Ohio State rep was saying that maybe they're being disproportionately affected because, exact quote, Black people don't wash their hands as well as white people. And this becomes especially troubling, not just for the sentiment itself, but the fact that this man was also an ER doctor. So that goes back to voice and participation. Do people believe you when they tell you they share their pain? You know, are you taken serious by the providers that are there to help you? The one thing that I think about the most is that when we talk about world applications, one of the activists in our research said, poverty is an exclusion from the safety system to the point where the person is threatened by the system that was created to ensure safety. And I think about that a lot now as when we look at, well, who's most being affected by COVID? How can we help not go back to the old normal and create a better future? Participation, that people told us their experiences beforehand, and because of COVID right now, we know that it's only gotten worse. Going back again to like, if you want to look at the dimensions and measure them and talk about racism, health and well-being. You know, just recently the AMA declared racism as a health hazard. But even before that, we could talk about everything from medical apartheid, maternal and infant mortality rates, and the fact that we know having a BIPOC doctor changes the maternal and infant mortality rates. But if we go back to structural racism again, we also know that 4% of the doctors in the US are Black. So, we talk about disadvantaged areas, like I said, redlining, being pulled over the police, over policed and under policed at the same time, and also the criminalization of people that live in public spaces. So these are all things that we can talk about when we say, look at the dimensions and put them into real world applications to use as a guideline. And now I'd like to turn it over to Guillaume for the next slide.
Thank you so much, Marianne. I mean, to build up on what you just shared about how those 9 dimensions could be used as a kind of global framework to look at what we do, to question our actions, to question the implementation of our goals and our way of functioning as a society. They can be also useful. I mean, we learn along the way that through the merging of knowledge methodology, we could raise interesting questions to look at some of the social policies that could be implemented. And some questions that people can ask themselves when they are thinking of building a policy could be if this policy enables people most affected to have control over their own lives. And as Marianne was saying, I mean, poverty is very much connected to being in control of your life. And so that's for us a question that is very interesting to look at in terms of policy making. The other is, does this policy enable people to have a sense of belonging and being valued in the community, as well as created connectedness across class, race, ethnicity, social identities, and other divides? This notion of connectedness is key. That's really something that also we learned in our research and beyond in the experience of poverty. And we know that there is a lot of solidarity in some community, and how does that plays in this community, among communities at a wider scale, and how the policies that are put into place are supportive of that. And lastly, last question that it could be useful to ask ourselves when we are thinking about policies and also about the evaluation of policies is, does this policy recognize and support the contribution that people living in poverty are already making in the community? So to really develop a focus to support the effort of the people living in poverty are doing. And here we are proud of the picture of the resolution that was adopted by the Massachusetts House of Representatives, who is recognizing the 9 dimensions as a general framework to think about anti-poverty policies in Massachusetts. So next slide, Jay, and I will let Marianne conclude. And so we will have enough time for the question and answer after that. So if you have questions, please feel free to write them down in the chat, please. Thank you.
So the one thing I would like to conclude with is that the merging of knowledge methodology that we used here, as you can see, the results are rich in depth. It goes so much more deeper than just the idea of financial as an aspect of poverty, because there's so much more contributing factors. But I will say that the merging of knowledge methodology takes time, but it's time well spent because the results are rich in depth and more in depth, and which can have a potential for people to tell you what you instead of telling you what they think you want to hear, but telling you how their lives actually are. So by, like as Guillaume was saying earlier, first by working in like groups, merging of method up, MOK provides opportunity to reflect with others from the same social and cultural background and propelling them to deepening their own reflections and solidifying their own knowledge. Then merging the three types of knowledge together provides an epistemological transformation characterized by inclusion, horizontal relations, and non-judgmental views. And so for people whose work primarily focuses on quantitative research, the merging of knowledge opens up multiple new steps of aspects of analyses. With one academic practitioner saying in our research, one major thing this research and work does well is help collectively educate people, even folks who study this. And another one stated, when I thought about those dimensions, I thought about the person as a unit of analysis. So much more came out about society, politics, etc., by taking the person as a unit of analysis. There's also a couple other things that this does, is that the impact of this research refers to the way in which people's ideas and action have been shaped in the new understanding of multidimensional poverty at the individual and institutional levels, policy agreement, or resolution. So one point, as activists said, the appreciated approach of thinking and deepening understanding of poverty, moving from a general aspect of abstract idea of poverty to the participant-specific, concrete, real-life experiences. Practitioners became even more aware of responsibility as professionals, working with people living in poverty and more cautious of unveiling their assumptions about poverty. Activists expressed a sense of being visible and being heard, feeling respected and embraced, and they were treated with dignity. And so it helps increase agency and power. So these are some little things that we can have the idea of why this research is, this methodology for this research is so valuable, because it brings out so much more. And I'm going to turn it back over to my colleague Guillaume, and we are going to open up the floor for some questions and answers. To hear your thoughts.
Yes, thank you. Thank you, Marianne. Thank you, Jay, too, for sharing your screen and managing so well all the technical difficulties. We have a series of very interesting questions in the chats. One from Conway and the other one from David that has, that have in common the notion of why didn't we focus just on income? Because, I guess we have all access to the very good and detailed question. Because if incomes increased, then stigma and shame will decrease, then all the other aspects of poverty seems not to have any other foundation than the income level. So that's a question we struggle with a lot. A very, very deep and interesting question. Marianne, would you like to share your thought about that?
I'm sorry, I was looking at the questions, but the idea that if the income is increased, that everything else will be less, correct? Yeah. When we were in New Orleans and that was one of the locations where we did our research with the peer groups there, one of the facilitators was talking about how even after Katrina, and this time was like about 12 years later, the area was still disinvested in. There was still homes that were still empty, or just even like the foundation of it. And there was still high levels of unemployment. Their hospital was gone. They lost some of the affordable housing. And she was talking about the idea that right after Katrina, FEMA was there. And some people, that homeowners, not renters, they were able to get a little bit of a check. you know, to help get them through. Not that much, but a little bit of, so they had money in hand. But as I said, it didn't make up for the fact that the schools were gone. There was high unemployment, high underemployment. The rate of incarceration for Black males was off the scale. So they were over-policed and under-policed at the same time. They now lived in a food desert because they lost their main grocery store in the area. So all of these different things. So yes, money is wonderful. We should all have more of it. But there's also some things that need to be done along the way too, because as I said, the little bit of money that people had in their pocket to get through that for a short period of time didn't make up for everything else that was there that also needed to help. You know, being able to have a job, you know, and get paid what you're worth, being able to send your kids to school in a good school system, being able to not have to travel an hour to be able to buy food to feed your family. So money is wonderful, but there's also other aspects that go on, because if we look at now the federal poverty guideline in the US, $1 above, you know, you're out of poverty, $1 below, you're in poverty. But even if you're that $1 above, there's still things that you need to help move you along in life. So that's my.
I mean, and maybe just, I mean, that's a conversation. That's really something we also try to continue to think about. My take on that is that if you refer to the wheel that we had on the screen before, and maybe Jay could lead us back to that, you could see, for me, there is two ways to really find sustainable solution to poverty. And the first one is connected to work and employment related hardship. If you have an approach that is relevant in this area, then as you said in your comments, you can have a positive impact on the other dimension. And the other one is participation. Participation is also an angle that could create a transformation in all the dimensions of poverty. In this research, one of our questions, I mean, one of the elements that we discovered also is that most of the time when you are in poverty, that also means that you don't have access to a job that will have a positive impact on your life trajectory. And so people worked a lot, but that doesn't mean that it could lead to meaningful increase of their income, or even a bit in terms of well-being. It's not that meaningful. And as Marianne was saying, the network developed through the job cannot be passed over to the next generation of their kids, and doesn't open up the future for the children. So yeah, so that's why. But yeah, very, very, very interesting questions. And please feel free to open. I mean, we should be ending this conversation in maybe less than 10 minutes. So we could go back to the plenary session. So if you would like to either ask another question in the chat, or open your mic and camera and just jump in, feel free to do so.
I have a question. This is Conway, who put the first question in the chat. Can you hear me?
Yes.
Okay, great. So I have a question on terms of, I really, I think this discussion is really helpful, and I like how the framework really brings attention to the aggravators and constants and the drivers behind these different dimensions. And I mentioned a comment when I was working on this, it was in terms of measuring poverty and trying to come up, looking at survey data and actually, identifying people who are poor to be an alternative to the income measure of poverty. Have you thought about how you would measure these different dimensions? I think that as a theoretical concept is really useful, but to take it to the next step, what about measuring these different pieces?
Marianne, would you like to?
Yes, we were also brushed up again. We were questioned that when we were describing our dimensions and naming the dimensions, because they're not what I like to call like hard things that are quantifiable.
Right.
They're more things that are, like we said, stigma and shame. But we know that there's the study that measures people's happiness. You know, there is still ways that this can be measured. We were talking about working on indicators and becoming up and doing that, and that would be like the next step that we were thinking about discussing and creating to actually measure them. But at the moment, we're also trying to focus on, excuse me, the idea that having people adopt these dimensions, just to start changing policy now and best practices and working. So, and Guillaume, was there anything that you'd like to talk to about creating indicators and next steps?
Yes, so in some countries like France, we are developing, ATD Forcewell is developing indicators with the French National Institute for Statistics to measure what they call there the institutional maltreatment. Our take on that is that if we want to measure, to develop a series of indicators that could be relevant for our dimensions, we should do it with people living in poverty. Yep. And so that means that I think here in New York, we also approached a few research centers to say, but at what condition could we develop a survey where the question would be worked on with people, so people living in poverty, so they could address this kind of issue. So that's a little bit where we are at in the process, and it's a fascinating question too. Yeah. Yeah. Thank you.
That's helpful.
Thanks. We have another question from Jess Jess Bartolo in the chat. What it look like to evaluate policy intervention based on its impact on the dimension. Marianne?
Yes. The one thing I've been finding, like seeing that we've seen in the policy of the past couple of years is who's being excluded and who is purposely being excluded, and how we are redefining who qualifies, who qualifies as being in poverty, or who qualifies as receiving SNAP or TAFDC or housings, any policies at all. So looking at like, does this isolation and stigma, does this policy increase the isolation of people? Does it increase the stigma? You may remember before the policies for people that were receiving SNAP had to take a drug test, to be able to, in New York, I think it was to be fingerprinted. In Massachusetts, you had to be photographed. All things that are done to people who are suspected of a crime, are being charged with a crime. So to be able to create shame-free policies based on the dimensions, like again, does it increase stigma? Does it increase shame for people? Does it exclude certain groups of people, purposely or not purposely? To say, like, how does it improve people's health or access? We talk about resource and health. Access to healthcare is one of the resources that we list, along with transportation. Does it make people's lives more difficult to access this policy? To look at it beforehand, so you can try to weed these things out of policy, but then also to go back and review policies that are currently created. We talk about disadvantaged areas. Do people in these areas, does this policy help benefit their life or make their life easier in some way? Does it help decrease, as I said, the stigma and shame for people? To go back and as Guillaume said, not only to use the dimensions as a measure for creation and critical review, but also to have participation of people in your critical review. When you go along and you re-examine a policy to find out, is it working the way it was intended? Are people being benefited from it the way it was intended? And if not, how can we improve this? And who's included on thinking the ideas to include it? And that's why we like to have the dimensions as a guideline, as they like, how does it affect disadvantaged areas? How does it affect people's health and well-being? So I hope that helps. Guillaume, I don't know if there's anything you'd like to add or jump on to the next question.
Yeah, let's, we have a few minutes to just answer the last question from Kate, but Jess mentioned a great example using SNAP to show that it was, how was it not made to intentionally increase stigma? Great point. So if you could quickly answer this question from Kate Lang, can you share your methods for connecting and learning from people who are living in poverty?
Yeah, sure. I mean, Kate, feel free to reach out to us, and we could really take more time to give you a sense of how it works. It's both complex and pretty simple. I mean, as long as everyone feels recognized as an actor of the knowledge we are building together, that creates a framework to really work together. But there is very concrete condition that we have developed over the years that, I mean, maybe we cannot recall them all now, but yeah, this notion of peer group is key. This notion of recognizing the other actors as co-researchers is key. The notion of building together the meaning of the concept or words that we were using is very important. So it's kind of building down or understanding of one question, and after building it up again together during the merging. But Kate, yes, feel free to reach out to us.
Yeah, thank you. Yeah, the information's right here. Please, we want these workshops to be interactive, so we encourage you to reach out to them and connect with them as this, do our best to network in this virtual environment, and hopefully connect people who are interested in this kind of work with Fourth World Movement. We're gonna have to end it here, so we have a few minutes to get back to the main session. You can use the same link. The link is the same for all 3 days. So yeah, thank you for joining.